The main messages in the article are really the significant advances, particularly in clinical research in 2024 in the fields of gastroenterology and hepatology. These, I believe, have significant impact on the clinical diagnosis and management of patients with GI and liver diseases. My name is Michael Camilleri. I'm a professor of medicine, pharmacology, and physiology at Mayo Clinic. The article we are due to see published in Mayo Clinic Proceedings in September of 2025 is entitled The Year in Review, the selection of the best papers in gastroenterology and hepatology in 2024. This was co-authored with a colleague, Dr. Evan Dellon from University of North Carolina. We selected these topics for inclusion based on publications in 2024 in the top general medicine journals: New England Journal of Medicine, Journal of the American Medical Association, Annals of Internal Medicine, and Lancet, among others. And often these same topics appeared in publications in the top gastroenterology journals, and therefore there was complementarity between what was appearing in the general medical journals as well as in the top journals in gastroenterology and hepatology. So we focused our attention in order to provide an overview of the advances in gastroenterology and hepatology with a focus on the needs or the interests of general internists, who are the primary providers for patients who present with these diseases or symptoms. General internists evaluate patients with symptoms like heartburn and difficulty with swallowing or irritable bowel syndrome. So let me highlight some of the features that appear in the article. In patients with uncontrolled heartburn, we focused particularly on the use of the new medications, which are now approved by the Food and Drug Administration, called potassium competitive acid blocking drugs. This medication, called vonoprazan, has the advantage that it brings the symptoms of heartburn and inflammation in the esophagus under control much more rapidly than the traditional approaches with proton pump inhibitors and histamine H2 receptor antagonists. With regard to difficulty with swallowing, we focused on eosinophilic esophagitis because, as you all know, eosinophils are now thought to be causing inflammation and dysfunction of the motor apparatus in the esophagus that leads to difficulty with swallowing. And importantly, one of the medications that's used in severe cases, called dupilumab, has now also been shown to be efficacious in children. Irritable bowel syndrome, there was a very large study from the United Kingdom on the use of amitriptyline, a neuromodulator, for irritable bowel syndrome patients in the community. And so this community level evidence was, we thought, important to bring to the attention of internists who read Mayo Clinic Proceedings. With regards to inflammatory bowel disease, an important addition this past year, has been that instead of needing to give a monoclonal antibody called infliximab intravenously, it was demonstrated that subcutaneous injection is also efficacious. And this obviously has very important implications. So patients may not need to attend an infusion center in the future in order to get this treatment. Another really interesting advance has been the attention on what I would call the director of the inflammation orchestra in inflammatory bowel disease. So as we all know, there are diverse treatments that focus on reducing the inflammation, from TNF-alpha inhibitors and interleukin inhibitors, interferon antagonists. And it's now been demonstrated that a specific type of mechanism called the tumor necrosis factor, like cytokine 1A and death receptor 3, is actually the director of that whole inflammatory orchestra. And interestingly, rather than having to target each one of those inflammatory processes, it is possible in the future to target this director of the orchestra and achieve benefits that would not otherwise have been achieved with single agents directed at one of those cytokines or inflammatory mediators. So this is not quite ready for prime time, but it certainly is an interesting new dimension that could have very significant implications. Of course, because of the impact that incretin therapies are having on all sorts of illnesses, including cardiovascular and cerebrovascular diseases and obesity, the GLP-1 receptor agonists and the combination of GLP-1 and GIP peptide agonists are also being used and very effectively in patients with metabolic associated steatohepatitis or metabolic associated steatotic liver diseases. Now, these are not quite approved yet by the FDA for these indications, but honestly, I think it's just a matter of time because of the great benefits that are being seen in the clinical trials, which continue even to be published in 2025. We focused on screening for colorectal cancer because there are new approaches based on blood tests, not just on stool markers, and these obviously will have greater application in the future, and they're often referred to as liquid biopsies in order to decide who should go on to get further investigation like colonoscopy. There's also been some advances in how to use immunotherapy or immune checkpoint inhibitors, for example, for treating colorectal cancers, in addition to chemotherapy, which is the traditional approach that has been used for advanced cancers. And then finally, a very important series of papers were written about the diagnosis of pancreatic cancer, either with imaging or sometimes patients have a cyst in the pancreas, and we, the gastroenterologists, and particularly my colleagues in endoscopy, can do aspirations of those cysts in the pancreas to check for the carcinoma embryonic antigen and also the genes being expressed in the cyst fluid. And so these are all advances in conditions that are very relevant, that are seen not only by gastroenterologists, hepatologists, but also by primary internists. Now, we at Mayo Clinic like to bring this to the attention of readers through the Mayo Clinic proceedings, because we believe this is one way to enhance the management of patients everywhere. And I hope that you will appreciate that given the breadth of the topics that we selected for coverage, there should be significant advances in the management of patients with GI and liver diseases based on the progress that was reported in these articles in 2024. And so I have great optimism that these novel diagnostic and therapeutic recommendations that are summarized in the article will be very relevant to many patients that are seen not only by ourselves in GI and liver disease practice, but also by primary internists. I'll again specify particularly the common problems of heartburn and difficulties in swallowing, colorectal cancer and pancreatic cancer identification and treatment, and of course the application of the GLP-1 receptor agonists for metabolic associated liver diseases. So yes, a lot of these advances are already at the level where they can be implemented in clinical practice. Others, on the other hand, may take some time and require further documentation and proof. And particularly, I will identify two areas that require further research, and those are the targeting of the TL1A DR3 orchestra director that I mentioned in IBD, and also further validation of the use of liquid biopsies for the identification of colorectal cancer, or at least surveying large members of the large swaths of the population in order to be able to identify who really should be getting colonoscopy and other tests to screen for colorectal cancer. So it was a pleasure providing this little summary of our article, which is due to appear in Mayo Clinic Proceedings in September 2025. Thank you.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.